Developing here right now, Defense Secretary Lloyd Austin has been diagnosed with prostate cancer. This revelation comes after growing controversy over his hospitalization after it was revealed the Pentagon waited several days to tell President Biden and the public about it. By the way, prostate cancer is the second most common cancer among men. So we want to bring in now Dr. Robert Princenthal, Medical Director for RadNet's Prostate Imaging Center. Doctor, thank you for your time here this afternoon.
Thank you, Michael.
Let's jump into it here. In your experience, what has been the biggest contributing factor for early warning signs that just go unnoticed?
The problem with prostate cancer is there aren't any warning signs. It's silent. And the only way for early detection is to get a PSA blood test, and then if it's elevated, to get a prostate MR to see if there's signs of cancer present.
Let's talk about those tests, okay, for prostate cancer here. Who should be getting screened and under what circumstances, in your opinion?
Great question. All men from 50 and over should be getting a PSA blood test. If you have risk factors, in other words, strong family history, if you have BRCA genetic mutation, or if you're Black, you might want to be getting screened at age 45. So if the PSA is elevated or rising, instead of going to a blind biopsy, we recommend you get an imaging study of a prostate MR. If there's a suspicious lesion, we can do a targeted biopsy and be sure we're hitting the most aggressive portion of the tumor. Many prostate cancers are slow growing and benign and can be watched, but some of the cancers, of course, are more aggressive and need definitive treatment, which happened with Secretary Austin.
Let's talk about how is it treated, and again, what is the survival rate here?
Well, unfortunately, the survival rate of early diagnosis of prostate cancer is very, very good. It's over 95% at 5 years. The problem is when men don't get screened and we see men presenting with a PSA of 50 or 100 and already have extra prostatic disease, then their prognosis is worse. Secretary Austin elected to be treated with prostatectomy, and with the advances of robotic prostatectomy, most of the men do very, very well. What Secretary Austin had is an uncommon, rare complication requiring additional intervention. Most men go home 24 hours after their prostatectomy.
Hey, doctor, before we let you go here, are these tests, these screenings, are they part of a yearly exam that we get?
It certainly should be. And we need men to fight like women because the incidence of prostate and breast cancer are identical.
All right. Dr. Robert Princenthal, we appreciate your time here this afternoon. Thanks for being with us.
Thank you.